Welcome to episode 5 of my podcast. I'm Dr. Sooj. I've got one of my friends here, Lotte. We still don't really have a name for this podcast, but that should not be a problem. But today we're going to be talking with Lotte, who's going to tell us a bit about her patient journey. It's very, very, very interesting. And there are going to be some pretty gory pictures that will be popping up. So, Lotte, just introduce yourself. Tell us a bit about yourself.
Hello. So I'm Lotte. I'm a software engineer, which isn't relevant to the story really, but I live on a boat where I am now. Boat. I've lived on this boat for 5 years now, and so the story we're going to tell you is from back in 2020 when I'd sort of quite recently moved on, but it was COVID times, and there's lots of spiders on the boat, and I got bitten by one.
Well, then, I mean, that's the perfect point at which to just jump into this. So first of all, what spider was it, and what happened?
Yeah, well, so basically, I'm 99% sure I got bitten by a spider. I didn't see it happen. I didn't feel it happen. But I saw on the wall behind where I was sleeping as I went to bed that night, a false widow spider. So they're quite distinctive. They're like, and we still get plenty on the boat, but you just have to say la vie, it's boat life. They're quite dark black, and they've got a big bulbous abdomen, and they've got like a sort of, it looks like a skull on their back. So they're pretty like freaky looking. They're very spidery spiders. And I saw one on the wall behind where I was going to sleep. I was sort of making the bed and just going, okay, it's okay, I'll get it in a minute. And then went to brush my teeth, came back or whatever, and I couldn't see it anymore. So I was like, okay, it is what it is. I'm just going to go to sleep. And then in the morning, like, I didn't notice anything in particular, like, to begin with, but I basically just felt like it was like I had a sort of sore hangnail or something, but I didn't have a hangnail. It was just like a soreness just in the corner of my fingernail. And it just like, I was working remotely, and it just got progressively worse throughout the day. I remember like, I had lots of meetings that morning, I think, and like I was sort of sitting in these meetings going, and then I remember one Russian colleague saying, "Oh, dip it in vodka," which I did because I was getting desperate because it was like quite sore and increasingly sore. So yeah, and it escalated from there basically, which we'll go into. I think, as I say, I'm sort of 99% sure it was the spider bite, because that basically when I was going through it with the doctors, they were like, have you been gardening? Have you had any injuries? Like, what's going on? And like, there was nothing else that sort of looked like it could have caused what happened. And then there was one Australian consultant who was like, that's a spider bite. And you'd kind of think, oh, they probably know. But yeah, I mean, like false widow spiders, we do get them in the UK. They're not native to the UK, so you are allowed to squish them. They're from the Canary Islands. But if you do squish them, don't squish them with your body, because they will bite you. They don't bite unless they're attacked generally. So I think what must have happened is that it had like crawled onto the bed, whatever, whilst I was sleeping, and I rolled onto it. And I don't want to freak anyone out about spiders, because I'm not I'm only as freaked out as the next person about spiders. I don't like them. We'll get rid of them. But I got incredibly unlucky, I will say. Like, I got really unlucky to be bitten, and then I got really unlucky that it got badly infected. So it's not like if you see one of these, it's definitely going to get you and kill you. It's just very, very unlucky. So you've got to live your life.
That's a very upbeat message, considering how many people are terrified of spiders. I mean, I don't like spiders.
They're not great.
And the fact that you would look at something like a false widow and say, "Oh, I'll just get that one later."
Well, I mean, I say that. That was at the time.
Yeah.
What it was, I mean, at the time, so this was like early COVID times, right? This was like literally 30th of March or something, 2020. And my partner is a paramedic, and he was the only one going out to work, and he thought that day that he might have COVID. So we were all like, that was the focus. We were like, he was going to bed in our room, and I was making up the sofa bed where I saw this spider. so that I could not get COVID from my partner. So that was the focus, right? It was like, oh my God. And it was so new that we all didn't know how dangerous it was. We were like, oh my God, we're all going to die because Rob's brought COVID home. So yeah, that was the worry. And now if I see a false widow, I will get Rob to take it away, and he's very good at taking it away. But yeah.
You were bitten by a spider at night time. We think it was a spider. And
Yeah.
then what happened? Did you wake up when it happened? Did you just notice it the following morning?
No. It was just the following morning. It started very small. So it just started, as I say, it felt a bit like a sort of, if you've been chewing your hangnails a bit, it's sort of a bit sore. And then it was like, oh no, this is sore. This is like an infection. And there's a series of photos that I'm sure you'll show of it sort of getting progressively more swollen and redder. And then at one point it started getting like very dark on the tip. So there's a couple of photos that I think show that progression of it. Like you get like a sort of black, getting quite purpley black on the tip. And at this point, I was WhatsApping my friend Ellie, who is a doctor and a GP. So she was sort of sending me photos back, going, draw around this bit, see whether this gets bigger, and just sort of calmly. And she told me later, like, when it started tracking up my arm, she was like, oh, okay, Lotte might die. So she was like very freaked out but she was being very calm to me, which was great. It's just exactly what I needed. So anyway, I'm very lucky to have doctor friends, right? So I was able to sort of get that instant medical opinion basically for free, which was really helpful. But basically, yeah, so it started getting sorer and sorer. That first evening, I basically couldn't sleep because it was getting so sore. So I went to the urgent care centre. There was literally no one else there because it was that period of COVID where no one was going to hospital because they were terrified of dying from this pandemic. So I got seen pretty much straight away, and I was given flucloxacillin, the oral antibiotics that people give you for skin infections. So took them home, and I was like told, so take these 24 hours or so and it should be fine, sort of thing. 7 days pack or whatever. So I started taking the antibiotics and still quite sore. I can't remember if they gave me painkillers. I think it was probably just paracetamol, ibuprofen at that point. And then the next day, it was just getting more and more painful, basically, like really swollen, because there's so many nerves in your finger. It's just very, very sore, and it was getting puffy. So by lunchtime, and I think I've got a picture. You can't see it super clearly on the picture, but you can see that there are red lines on my wrist. I sent those to my friend, and she's like, okay, do they have an inpatient department? It's time to go to hospital, sort of thing. So and at which point I said to Rob, oh, can you drive me to the hospital? Ellie thinks that I should need, she thinks I need IV antibiotics, basically. So we had our lunch, went to the hospital, went back to the urgent care centre at West Mid, which is our closest, and she sort of took a look at me and then phoned. I think the lady who saw me, the nurse or whoever it was, had previously worked in the hand plastics department at Chelsea Westminster, so she knew the direct line, phoned them up, and was like, "I'm sending you someone." And so Rob then drove me down to Chelsea Westminster. It was just such an odd time. I've never really been to hospital apart from this, but I'm still quite aware of how weird an experience it was because, as I said, there was no one in the sort of clean zones. Like there was a sort of COVID red zone which I had been diligently locking down for the last couple of weeks. No one was wearing masks. And it was like, oh my God, I'm going right into the fire. But then, you're going into the clean zone, there's no one else there, and you get seen immediately because all the consultants are wandering around with nothing else to do because they're not on the COVID ward. And so they kind of took one look at me and admitted me, and then were like, okay, well, we want to drain this because it was getting very, very puffy and very, that was, I think, what was causing a lot of the pain. And they said, okay, we want to drain this, so that'll involve sort of cutting your fingernail off and slicing it into it, basically. And they said to me that they would normally sort of consider doing this under general anaesthetic in an OR because it's so unpleasant, but that there weren't any ORs available because it was COVID and I might be waiting 24 hours. Or they could do it now under gas and air and some morphine. So that's what we did. So it was really, really unpleasant. It was like, yeah, and I vocalized my pain, and I did warn them this when they started doing this. It's like I am going to scream, and I did scream a lot. But the gas and air, oh my god, that was great. The gas and air really helps, and I started talking absolute nonsense. But that really, I was surprised how much that helped. But
I am as well, to be honest. So we use gas and air even during labour, and it can be really good.
Yeah.
But at this stage, how big was your finger? How big was the purpley black bit? And when you say it's tracking down your arm, like where was it tracking to? Because
I think at this stage, my finger was. I think I've got photos from. I don't know how exactly what time those photos that I've sent you were from, but roughly it was. It was puffed up. I think I've got a sort of comparison photo from maybe a couple of hours before I went in, and it was significantly swollen, but it was just very, very, very sore. And the tracking I think was probably sort of up to there or something. So it's going up my arm in sort of lines, maybe sort of 0.5 to 1 centimetre wide. Yeah, I don't know exactly. You know what? I was sort of going through the sort of timeline for myself. Yeah, I'm now doubting myself because it was 4 years ago, and also I was quite sort of delirious with worry and pain and then a fever. So I'm not certain. I may have been in hospital for 24 hours on IV flucloxacillin before they cut me open, actually. Cut me open, that sounds very dramatic, but cut my fingernail off. So
but that makes
may
sense.
have been.
For anyone that doesn't know, we when we want to cut someone's fingernail off, we usually do something called a ring block, which is where we put a bit of local anaesthetic in here and here to numb the nerves, and then the whole finger goes numb, and then you can basically do what you want with that finger, and the patient won't feel anything. So I'm suspect that they would have given you a ring block whilst giving you gas and air, but I'm not 100% sure what else they would have done to it. If they're draining something, I mean, it sounds pretty savage.
I think you're right. I think they did give me some local anaesthetic. But, even with, like, as anyone who's had anything like this when you're awake knows, you can still feel all the tugging, and it was still it was like, so I think you're right. And that maybe it was that rather than the gas and air that really took the edge off, right? And then it was just quite traumatic, right? Because you're just being held down. I suspect now that I'm saying this, I think I was in hospital for 24 hours before they did this. I think it was IV flucloxacillin, see if that clears it up first. I think that's what happened. In which case, what had happened over that 24 hours, I know, because I've got another picture that you'll see these like Sharpie lines on my arm. That was when I'd been in hospital for a day, and that was where the tracking was. So that they're like big, thick lines all the way up to my shoulder. And that first night in hospital as well, I had like quite a high fever and got, I was really quite sick, like deliriously, like not well. And I suspect now that I'm sort of recounting the story, I think that's probably when they did that. Okay, we're going to cut you open, and I think that's partly why it was so sort of it was such a sort of traumatic experience, because I was really ill as well. I'd got quite, sick, and then that made it. And also what makes it slightly scary is when you've got the junior doctor coming in with a Sharpie going, which I'm glad they do, because but the sort of slight, like, you could see the sort of fear, not the fear, but like the there was a look of concern, and you'd like, which is good. You need people to be concerned and do their job, but like you can see that there's a look of concern. Anyway, I think that's the point at which
I've done that
they cut
before.
it open. Yeah, yes. I bet. I'd be concerned.
I've
And
definitely
also,
done that when you're giving people like massive doses of IV antibiotics, and you're like, okay, yeah, this will improve in the next 24 hours, and then you come back and suddenly the tracking line isn't here; it's now gone up to here, and you just think, oh, well, that's not a good sign.
yeah. It was the same doctor it's the same junior doctor who'd like signed me in, like admitted me the day before. So like he'd seen where it started and where it was going. So that was, Anyway, so they cut my fingernail off, blah, blah, blah. I did a lot of screaming and squeezing the nurse's hand. And if we're talking about patient experience, I think there was one thing that sticks in my memory, because it was also, I think you're right, they would have put local anaesthetic in and then given me morphine. And as at the sort of transition of those, when the local anaesthetic was wearing off and the morphine hadn't quite kicked in, that was hard. That was a lot of screaming. And that was when they were wheeling me back onto this ward with other sick people who didn't want to hear it. But this lady came up as I was sort of settled back into my bed and just held my good hand and squeezed me and just did breathing exercises with me. And I think she was a volunteer, which was just amazing. And I'm so, like, I remember her, and it was like, to be going in and doing that right in the thick of COVID as well was pretty amazing. And like, it made a huge difference. It was just like, okay, no, I can do this, because the medical staff, all the doctors and the nurses as well, are like, they got other shit to deal with. They can't deal with my like breathing and panicking as well as keeping everyone else alive. So it was amazing that she was there. But yeah, so, and then I just basically had a couple more days of, then they put me up to Linezolid. That's when they put me up to Linezolid, which is like I've told this story to a few doctor friends, and they were like, oh, it's like a pretty beefy antibiotic. And I think it was like okay, we don't know what this is. Sort of moment of like, I don't think they did know what I've never heard that they figured out from the bloods or anything what it was. They were like, just, okay, throw the big boys at it. And that worked.
I've never seen Linezolid being used in real life, but I remember learning about it at med school. And I used to say as a joke, it's fine. If anyone gets really unwell, just chuck them on Linezolid and they'll be fine. And now knowing that you've actually used it, to be honest, because of the massive rise in antimicrobial resistance, while I've not actively seen people on Linezolid, I have started to see it in when we send off samples to the microbiologists so that they can test it and culture it, grow whatever bug is on there, and then test it to see what it's sensitive against, what antibiotics would affect it and kill it. I'm now seeing more and more that Linezolid is being listed as one of those antibiotics, and that actually really terrifies me, because that was like the antibiotic which could just kill anything. Obviously it doesn't. I'm not a microbiologist, but the fact that I'm now seeing that turning up on these microbiology reports is really concerning, because it just makes me more aware of the fact that antimicrobial resistance is going to be a massive threat to humankind in the next 25 years.
Absolutely.
And it's terrifying.
It's a really important point, because I'm really aware that actually, if it weren't for antibiotics and the fact that they did have this big boy to throw at me, I would have at least lost my finger, if not my arm, if not my life. If you don't stop this sort of infection, like that becomes sepsis very quickly, right? That's not great. So yeah, I'm very aware that antibiotics saved my life. And so, I've occasionally, because I studied sciences, and so I loved all this shit and remember it all, that, learning about antimicrobial resistance at GCSE level. So I feel like I've always kind of known, okay, this is what antibiotics do, and this is why you take all of them, and you don't use them for trivial things unless you need them, sort of thing. And then I was meeting people in my adult life going, oh, you've got a cold. Oh, just go to go and get some antibiotics. And there are countries in the world where that is a thing. You can just go and buy antibiotics over the counter, and people will take them thinking that it'll get their cold, which is a virus and not going to work.
It's good that you mentioned that, because the antibiotics for viral illnesses do nothing. But there are some cultures, and I see this in general practice, where people just want antibiotics, and then they get really the consultation just takes a massive nosedive as soon as they say, I want antibiotics, and you say no because it's a viral illness. People really, really don't respond well to that. And it's hard because I try to explain it, but because their whole life they've been told, just take these antibiotics and you'll be fine, they then think that I'm a bad doctor because I'm not giving them the antibiotics, which they think is the treatment. But let's go back to your finger.
Yeah. Okay. Back to the
So
finger.
you've been put on Linezolid.
I've been put on Linezolid. I mean, the other thing to say about Linezolid is, I mean, it was like my partner's a paramedic, as I say. So he has this, and he's quite a sort of stoic-y sort of guy. So, like, if I get a boo-boo normally, he's like, you're fine. This time he was going around like doing little prick tests on my toes to make sure I still had like all my nerves intact. He was worried because he had looked, and like I don't necessarily suggest that you do look up the sort of horrible side effects that can happen with like big antibiotics like this. But anyway, so this sort of stuff was going on, and I'll explain how that affected me afterwards. But yeah, my finger. What else was there to say about the time in hospital? I think one thing that surprised me, and I think I mentioned this to you when we spoke about it before, I think I was surprised because I'd never been to hospital before, let alone stayed overnight, just how little you like regularly see the doctors. So, you're admitted, checked in, given the IV flucloxacin and sent to bed. And then you've got the nurses looking after you and they're fantastic. But then you see the doctors in the morning for the ward round, and then they cut you open and leave you back on your bed. And then that's it. You don't see them again until the next morning when they come and do the ward round. And in the meantime, you have no idea what's going on. Like, the nurses don't necessarily know. They just go, okay, well, you're on these meds and we're looking at your vitals and seeing whether you're still alive. And that first day, again, I was getting worse. So I'd been put on these IV antibiotics, and sent to bed, and I just got worse and worse and worse, and I didn't know what was like. You've got so little agency, and I feel like I'm quite good at submitting. Like, I'm very good at the dentist. I will just go deep breath, fine, do what you need to do. I'm quite good at that, but I can see how people do get the sort of the heebie-jeebies, as it were, about it, because you've got so little agency, and there's no one really you can ask for an update. And I can see you don't, as a doctor, you don't need to be asked for updates by all your patients all the time. But I did find it unnerving, and I think I was also very aware that, again, I've got lots of doctor friends who I was on FaceTime with the whole time and just like had a lot of reassurance from them, or like, they were explaining the process to me or whatever, or checking up on me. So I didn't feel, I felt like I had that bonus, but most people don't. And also most people don't necessarily know any doctors in real life. So, I sort of, there was a familiarity, because, they're not like, doctors to me are not unknown other special creatures. They're my friends and family, sort of thing. Anyway, my point was, it was unnerving that you only see them once a day, and then they sort of do all this stuff and then leave you alone again, and then don't necessarily explain everything very clearly, because you're in whatever state you're in, screaming away, and they don't necessarily, like, that's not their priority always, explaining what's going on. So yeah, I found that quite scary and interesting, and like, I don't know what you do about it other than just sort of, I think to be honest, I think the sort of stuff you're doing here with this podcast of just generally educating people so that they feel more comfortable with how it all works is probably the main thing. So yeah.
Until you told me that it was weird that you didn't see the doctors all day, every day, that you only saw them once in the morning and that was it. I had never recognized that. I mean, I've been a doctor for this, I'm in my 10th year now, and that's just bread and butter stuff. That's just, we do the ward round. If things go badly, that's when the nurses start calling us because patients need another review. We need to change the treatment. We need to escalate treatment. We need to do something like that. Or on the flip side is if you're so well that you need to be discharged, then maybe you just need a quick review. We just need to explain what needs to happen. But if you're anywhere outside of those two extremes, so you're just like the majority of people where you've been seen by the consultant or the registrar in the morning, so one of the senior doctors, and they've given us the plan, then we just need to wait for that plan to work. And I used to get really scared when I was a first-year doctor when things would start going wrong with patients. But one of my registrars at the time gave me some really good advice. He just said, there's actually very, very few things in medicine that will kill a patient quickly. And those people, you will know that they are unwell. Otherwise, generally what we tend to do is we assess them, we try a treatment, we try and cover all bases with that, but we try a treatment for the most likely problem. We wait. If it works, fantastic, we continue it. If it doesn't work after a day or 2 days, we change it. And it was just hearing it in that really clear way that just crystallized it in my mind that, okay, great, fine. So actually, we do have time. It's not a case of a lot of things I learned in med school, which is this is a medical emergency. Because my now tolerance for what is an emergency has changed. And if like I become much less panicked in certain situations, but that's just because of experience. Like when I was working in intensive care, so in hospitals, if someone has a heart rate of over like 110, 120, you worry and you need to do something about it. When I was working in intensive care unit in Papworth Hospital, which is like one of the biggest cardiac ICUs in Europe, people having a heart rate of 140, 150, and the consultant just standing there going, that's fine. And again, it's just goes to show that experience is so important. But you're right about it's so worrying when you only see the doctors in the morning, which is actually not a bad thing. But obviously think about it, like doctors will have either the whole ward or they'll have the whole ward plus outliers, plus they'll have to do stuff in A&E. So people think that, oh, where are the doctors? They're just doing nothing. But no, we're like doing everything everywhere.
Totally.
And then we have frequent meetings through the day so that everyone is aware of what's going on.
This is, I mean, and this is like, when you explain it, and of course it makes total sense. And this is also, you know, I know, like, again, because I've got friends who are doctors, and I know that they'll have days when they don't have time to take a sip of water, let alone eat lunch. And it's like, so I know that they're not doing nothing, but I just hadn't sort of clocked. To be honest, maybe they did explain it at the time, but I think it was, I think maybe just it's just like someone going to you, okay, we're going to try this. We will see you in 24 hours. If anything goes wrong, the nurses will call us, or something like that. Because when you put it like that, it's like, well, of course, that makes total sense as a system. But I think the sort of, I don't know, it makes total sense. But when you're in the thick of it, it's like, where's everyone? I'm really bad. I'm really ill. And, you know, it's just scary, isn't it? But they were all great. They were all brilliant.
Right, so then Linezolid and finger redness tracking up your finger, and then you'd had it drained once, you had the nail removed, but there's more to the story.
So in fact they tried to drain it. That not much came out, oddly, and I think this is one of the things that one of these again, I was seen by like maybe 5 consultants because they were all around and I don't think that's normal. But anyway, this is when the Australian consultant was like, oh, it's not draining. Okay, this looks like a spider bite. So annoyingly, cutting my finger off and cutting it open didn't really do much to ease the pain. but anyway, so I was sent home when, the tracking disappeared, fever came down, it all got sort of stable. And then the pictures get gorier because this is when the sort of healing started. But basically, the whole tip of my finger had gone necrotic. It had gone completely black and the flesh had died. So I've got a series of photos that I'm sure your lucky followers will love to see, of the fingertip going like kind of congealing black and then kind of falling off. And yeah, it was really gross. It took a good few weeks, sort of thing. Yeah, pretty gnarly. But anyway, it eventually healed up. My experience at that stage was basically really quite severe health anxiety. So I came home and, it had been like, that was genuinely traumatic. It was like being held down, having your finger cut open, being delirious, all during COVID. No visitors, of course, because it was COVID. And my partner's still out working on the front line as paramedic, and all the fear, everything going on. And I came home and I had a stutter for like a week. I've never had a stutter before, but especially whenever I had to talk about what had just happened, I was stuttering genuinely. And that was unnerving. And then everything was like every little twinge, because it had started so small as just a little, it's just a little niggle, that's normal. It's just a little, my finger's a bit itchy, and had escalated so quickly. Everything was like, everything I felt in my body was like the end of the world for quite a while. And it was like, there were also every possible side effect that had been mentioned to me was coming true. So I was convinced, I was very convinced that I had deep vein thrombosis, and was on the phone to my doctor friends, getting my housemate to take pictures of my calves. And they were saying, no, it's okay. You don't have a DVT. You would really know about it if you did. You've just got sore legs, basically. But I was, convinced I was having panic attacks because I thought, and then you also have like all the effects of the opioid drugs that you're on. So oral morph I was on in the hospital. So oral morphine, which I hated. I never felt like, I never got the high that people love morphine for. No, fuck, I hated it. It just makes you really constipated, like opioids. And then I was sent home with codidromol, so it's like paracetamol with codeine in it. And again, just like takes the edge off, but makes you constipated. Everything felt a bit sort of fuzzy, but not in a fun way. And and there were other sort of side effects that I again panicked about. So I had a little bit of like spotting, like bleeding, like from, like you would get between periods, that can come sometimes be like a sign of like cervical cancer. And I was like on the phone to my GP crying, going, oh, I've got cervical cancer. And she was like, no, you're fine. Like, this is like a side effect for all the drugs and everything else. But so I didn't know that could happen. And so yeah, it was just like those few weeks of healing were not just physical, basically. It was also like just recovering mentally. And it was in a way surprising. And I think, I don't think people would dismiss it, but I was a bit shy about how much it had affected me when I was in hospital for 3 days, and we were in the middle of, the context was this global pandemic, people were dying, and I felt a bit like silly because it's just my finger and I'm fine, but actually it was really, really tough. Like I had, and the health anxiety took a good while to wane, and I think I'm fine, basically. I don't worry about little niggles anymore, but I will, if I ever see tracking up my arm, I will go to hospital. I feel like I've talked it out. And this is one of the reasons I'm sort of so keen to come on this podcast, because I kind of love talking about it, because talking about it, every time you talk about it, it sort of lessens the sort of fear in it. But yes, that was scary. Oh, and yes, because I remember going back, I had to go back to hospital for a couple of dressing changes, and I think maybe the first or second time I went back, like that was incredibly painful. The first couple of dressing changes when they took everything off, and it was like incredibly painful. And I think the very first one they did in the hospital, I was even given gas and air through the little canister thing. And the next one I wasn't, because you're an outpatient walking in for a dressing change. I'm not going to give you gas and air. Don't be
Do you mean
ridiculous.
Penthrox?
Probably.
Do you
Yeah.
mean Penthrox, like the little, it's like a little, just like a little thing that you hold in your hand, put a little strap on it, and then it smells. It smells like gas. It smells like
Yeah.
petrol.
Yeah, I think so. It was, and I was sort of puffing on it, and it helped, basically. And then, but yeah, like this, when I went back in for a dressing change after, and again, it was like in this few weeks where I had a stutter, a lot of health anxiety, and I was like, I just had a panic attack in the room, and I couldn't. She had to send me away and get me to come back another time for the dressing change, basically, because I was like, I think the nurse who was seeing me had never seen me before and was like, why are you making such a fuss? This is ridiculous. And then I went back in the next day, and I think she'd like spoken to the other people in the department who were like, oh no, we had to sort of strap her down and cut her fingernail off. That's why she's freaking out. And she was like, much kinder the next day, basically. So yeah, so it took a good few weeks. And it was also like anything on your hand is such a pain in the bum, because you can't, like, you have to keep it dry for showering. You can't really do anything. It was my right hand, and I'm right-handed. Like, everything was just a bit crap for a few weeks. But I'm fortunate enough I had housemates and a partner all helping me out, and that's all right. But yeah, miserable time. But I got 3 weeks off work, watched a lot of Tiger King, and I didn't lose my finger. I spent a lot of time in those, the 3 days that I was in there. Again, because you're sort of left to your own devices, you don't know what's going to happen to you. I play violin and trombone, but violin, like, that's your bowing hand. But I spent a lot of time working through in my head, okay, so if I lose that bit of my finger, that's how I will relearn to hold the bow. And if I lose that much, that's how I'll relearn. And just going, oh, thank goodness it's not my left hand, because that would be much harder to relearn. And that's what I was thinking the whole time. And fortunately, I didn't lose any bits of my... Oh, I lost the tip. Just the tip.
Just the tip. Can you... Thank you for sharing all of that. Would you be able to just talk me through how you managed to overcome the health anxiety? Because I think health anxiety at the moment is rife within public, within society. And it's because we have so much information at our fingertips, and everything tells you have cancer. And if you don't understand how to, you can be scared into a position. It's very common. People get scared into a position, but then if you don't have the knowledge, you then can't reason yourself out of that position. Now, I've seen this in myself with like super weird. My mind will often go to the worst case scenario, because I know what can happen without even looking at Google. I can generally reason myself out of it. I'm very lucky. My other half is also a doctor.
Yeah.
So
yeah.
But in a world where you don't have that knowledge and you can't then reason yourself out of it, how did you overcome your health anxiety?
To an extent, it was time, and just like in that first few weeks, everything, like, and I think I had good advice from people around me, maybe, that was, I had people to check with. How did I overcome it? I think with stuff like that generally, because I've also struggled in the past with OCD a bit as well, and the sort of CBT stuff that I did for that helped hugely. Where basically, if you get these thoughts and these worries that sort of intrude, like, oh, my toe hurts, I'm going to die. You're this sort of catastrophizing loop that you get into, which is what that all is really. You kind of have to not feed it. And so actually Googling stuff is often the worst thing you can do. Like just not feeding, not giving into the compulsions, basically. So an OCD is you have an obsession, and then you have compulsions like checking it all the time, or asking for reassurance as well, like going to your doctor friends and getting them to take pictures of your calves to check you haven't got a DVT. That's compulsive behavior, and actually that just feeds the obsessions. So trying to not do that is really good. Like if you're seeking reassurance by Googling or asking people, like recognizing that as a compulsive behavior and going, oh, I recognize that that's compulsive behavior, I'm going to try and not do it. That can be helpful. It takes practice to recognize them. And what else? It's tough because you don't want to miss cancer and get it. But generally, if you can leave it a couple of weeks or a month or two and see if it changes, then and then if it changes, then go and ask a medical opinion. Like stuff changing, I think that's been the advice I think that I've taken to heart a bit. Like if it's not changing, it's probably fine. Like if you've got a mole on your leg that you've always had and it's not changed for 20 years, it's probably not skin cancer. But I was finding myself in this sort of period, I think it was probably a year or so after this finger episode, I was going to the doctor going like, I've got these moles, like I'm going to die, and was going through that, and she checked me all over. It's like, you're fine. They've not changed. And then told me what to look for. But yeah, it's experience, it's practice, and
I will just say one sec.
Yeah.
This none of this is official medical advice. There are loads of things.
Totally,
there are loads of things that can happen to people, which are early stages of cancer and things like that. But if you ever have any concerns, please just go and see your doctor. Don't.
Yeah.
Some people, yes, watch and wait. Sometimes that is our advice. But if you are concerned, go and see your doctor because we can reassure you.
Fair enough.
I don't always recommend people look at Google because if people get really, really scared by looking at it. I think some people are able to analyze information appropriately, or if they have a diagnosis, they probably know more about that condition than I do, possibly, particularly with some chronic illnesses. But like, if anyone has any concerns, go and see your doctor. Lotte is just sharing her experiences.
I think it's. I think when I was talking about stuff being compulsive behavior and recognizing that, I think what signified that for me was that it was every little twinge. That's when you can recognize it as, oh, actually, this is something that's going on in my brain, where it was like every little thing that was happening in my body, I was seeking reassurance about. Like that was not healthy. If I've got something, anyway, I'll stop leaping in with the not medical advice. But yeah, it was practice, recognizing the sort of unhealthy patterns, and then and time. And I was at the time given, like, I had a nice phone call with again, I've just got lots of useful friends. So a friend's mum who's a psychotherapist, and I was calling her up and going, I've got a stutter, my brain's broken, what the hell? And she was like, you've had this little trauma. She didn't say little, but I'm calling it little. But like with any injury to your body, the mind will heal.
Trauma is in the eye of the beholder.
Yeah, totally. It's all relative. But she was like, look, the mind will heal like the body will in these situations. Give it time, give it rest, and take it easy, and it will heal like your finger will heal. And that was good advice, and that was what came true. But it's tricky because as you say, like, you do need to go to the doctor and get things checked out. And I don't think now I sort of am in a healthy place there. I know that I will go to the doctor if there is anything actually wrong. And it's easier for me now, having that experience, to recognize with practice when it's just anxiety. Not always, you're not always going to get these things right. But I think it was also interesting. This is a whole different story, but I had last year, my mum ended up in hospital in France where they live, but for an unexploded aneurysm, basically, that she got coiled. So that was all really scary few days. Like, she's fine, but oh wow. And she then also had this period of intense health anxiety in a really similar way to I had. And I was there with her. Fortunately, we were over for Easter when this all happened. She basically woke up one morning, lost her short-term memory entirely, and started talking nonsense, and we took her to the hospital. So, but she, for a while, like, similarly, every little thing was like, because it was something, it felt like similarly something sort of that had escalated so quickly. And when you have that experience of something escalating from nothing to like 0 to 100 in no time, to like, oh, this is life-threatening, then it can be really very easy to slip into thinking that every little thing is going to do that. So, but it was really useful then, because I was then, 2 or 3 years post my experience, to be able to sit with her and go, this is what happens. You're okay, and you will feel like this for a while, and you will get better, and your mind will heal. And she's mostly fine now. She worries a lot about, like, my parents are living their best retired life, and they're going to Machu Picchu and the Galapagos Islands in next year. But it took a lot of persuading that my mum would be okay going on airplanes and going to altitude, and she talked to her doctors and all of this. So, it is a very common thing to experience, I think, in my anecdotal experience, but I wouldn't be surprised if it's very common, because it makes sense. Your brain is going, it has now suddenly been told, oh, a little thing can kill me. Like, and then every little thing feels like it's going to kill you, but it's generally not.
But also, even in hospitals, there are lots of people around you who are also very unwell, and you can't sleep very well because there's lots and lots of flashing lights everywhere, lots of machines beeping. There's, even at nighttime, they'll dim the lights on the ward, but they still come in every 4 hours to do your blood pressure and your heart rate, and you will wake up during that time. And if you're unwell, then it will be more regularly than every 4 hours. Sometimes it's every 30 minutes or every hour. And even if it's not happening to you, if it's happening to someone in your bay, you will wake up when all of that commotion is going on. And then if someone needs a medical review, then obviously the doctors come in and start talking to people. It's just, hospital environments, like they are incredible at treating people, but they're not necessarily the best place for healing people, in that there's always so much commotion.
Yeah, absolutely. Like, the healing, I mean, I was fortunate that I was kind of only there for 3 days, and hospital was for dealing with the source of the problem, the infection, but the healing happened at home for sure. That was, I would not have got mentally better had I been in hospital for those 3 weeks, I think. But they are kind of scary places. Like, not scary, but they're just like, it's never going to be a pleasant experience. Like, you're generally only in hospital because you're really ill, or someone you know is really ill, unless you're a doctor. You're just there every day.
There's one final bit I wanted to ask you about, which was your finger was debrided, though, wasn't it? Like, all of the black bits were cut away. Is that right?
No, they fell off. No.
They fell off.
As far as I know. So I've got a scar. I'm not sure how well you can see it, but you can sort of see the line where they cut. They sort of cut there. I mean, and then I don't think. Okay. I think they just sort of cut it to sort of to see if anything would ooze out. I think. But I don't think they cut anything off, as far as I remember. And then, so all those pictures that I sent you, where it was going black in the sort of healing process afterwards, that just went like that and then fell off like a scab, basically. It's pretty gross.
That must have been a pretty a bit of a wild experience, because how do you even know what's happening?
It was, I mean, I think they'd probably told me that this was what was going to happen. And it was quite clear that, like, those black bits weren't going to suddenly get better. Like, they were quite clearly scab-like. You know, it was, yeah.
Dead.
And it was quite clearly dead. So I think I'd been told by that point what to expect. And, you know, I went in for dressing changes for a little while and then was doing my own. But for those dressing changes, I think they would have had a look and gone a reassuring, oh yes, this looks like it's all healing up fine. And you look at your horrible gnarled black finger and go, oh yes, looks great. But, you know, to be honest, I think I was just very grateful at the time, I think, and apart from all this health anxiety stuff that was going on. In terms of my finger, I was just very grateful I still had all of it, really. Because I was convinced for a while that I was, like, in those few days that I was in hospital, I was like, surely they're going to cut this off. It hurts too much not to cut it off. What's going on? Sort of thing. So, yeah, as I say, I'd come to terms with what my life would look like with no primary index finger. But, yeah, it was a bit gross. I think my housemates found it more gross than I did, because when it's your own, you kind of go, oh, fascinating.
Well, look, thank you so much for sharing your journey, sharing your story. It's been really interesting, really fascinating. I'm glad that you have managed to, like, overcome your health anxiety. I think that's something that we see quite a lot in general practice, and it'd be really, really hard for people to even recognize and address.
Absolutely, yeah.
But yeah, so thank you so much for your time this morning.
Yeah, it's really nice to chat to you. I enjoyed it. I love talking about this. It's about the most interesting thing that's ever happened to me. So it's always fun to chat about.